Assalamualaikum everyone, welcome back to this channel. So this is me Alia Bhai, and in this video we are going to start the topic of drugs which are acting and which are used to treat your ulcer. So in the previous lecture we have discussed that what is the ulcer, and we have discussed what are the types of ulcer. These are peptic ulcer and these are duodenal ulcer. We have discussed their location and we have discussed them from their initial to their final stage, and after that we have also discussed what are the causes of your ulcers and what are the things that can make your ulcer more severe. Now in this lecture we are going to start at what kind of drugs you will give to your patient in order to treat him from the ulcer. So the first drug which is used to treat your ulcer are the antimicrobial agents. So when you will give antimicrobial agents to your patient when this ulcer is particularly occurring due to a bacteria. So whenever the causative agent of ulcer will be a bacteria, will be an example of bacteria which can cause ulcer is the H. pylori, Helicobacter pylori. So this bacteria can cause ulcer to you. So therefore these microbial agents are effective for both type of ulcer, peptic ulcer as well as duodenal ulcer. Now let's discuss how to diagnose that your ulcer is due to a microbe. So let's suppose that we don't know that a particular patient has ulcer, but due to what reason. So we have to find out whether it is due to a microbe. So therefore, in order to perform the test, we will perform these kind of tests with the patient. So the first test is the urea breath test. This is very important. Second is endoscopy. I will explain urea breath test here, so just wait for a second. Then the second test is endoscopy. So endoscopy is the type of method in which we will introduce a tube-like structure into the patient body from the mouth, and this tube-like structure has a camera on one end. So from this camera the doctor examines that whether a patient has ulcer or not. Second is the biopsy. So biopsy is a method in which we will perform first the endoscopy, and with the endoscopy we will attach an instrument which will pluck the tissues from a particular area, from the stomach, from the duodenum, and after that we will examine or we will observe this tissue, and we will detect that it contains specific microbes or not, and after that we will give results or report to that patient. Then serological tests will be done. Serological are the antigen antibody reactions. So we will detect them that whether the bacteria is present or not. And lastly we will done fecal antigen test will be performed. Now let briefly discuss about this test, urea breath test. So let's discuss what will happen in the urea breath test. So first of all, let's suppose that your bacteria is present inside the stomach. So this is the H. pylori bacteria. So now this H. pylori bacteria, I am drawing it in that shape. So this bacteria is going to produce various kind of enzymes, and this enzyme is urease. So let's suppose the dots are urease enzyme. This is what urease. This enzyme, urease enzyme, is for digesting urea. It is used for converting urea into carbon dioxide as well as into ammonia. Okay, now how we will perform urea breath test. So in that test what we will do, we will give a patient a medicine or something else, which medicine contain urea plus isotope of carbon. So carbon 13 we will give to that patient. So these both things will enter into the stomach, goes to here. Then what will happen as the urine introduced, so the urease which is secreted by that bacteria, this urease convert this urea into carbon dioxide and ammonia, and due to the C13 it will make the carbon dioxide with C13 isotope. Now this C13, this carbon dioxide will release out through your lungs by the exhalation of your air. So you when the patient exhale his breath, then you will collect that breath and then you will examine it whether it contain the isotope of carbon or not. So if it contain the isotope of carbon C13, then it's mean the particular patient has ulcer due to H pylori. If the isotope carbon doesn't release, it mean the patient is has no ulcer due to bacteria. So this was the method which is used in the detecting that whether a patient has ulcer or not. Now in order to give antimicrobial agents, we will use combination. So we will never give alone an antimicrobial agent to that patient. So in order to make your drug more and more effective, we will give combinations, and these combination can be triplets and can be quadruples. Now let's discuss about these combinations. So as we have discussed about the triple combination therapy, so in the triple combination therapy, you will give three drugs to that patient. First, you will give any antimicrobial agent in order to kill that bacteria, antimicrobial agent. Secondly, you will give antacids to that patient. So antacids are used they are weak bases, so they are actually reacting with the acid HCl and performing the neutralization. So they actually are decreasing the secretion of HCl. And thirdly, you will give a proton pump inhibitor. I am writing it as PPI, proton pump inhibitor. We will discuss it in this lecture till the last end, so therefore watch this video from initial to the final end. So these are the three combination therapy for it. Now there is also a quadruple combination therapy. Qua- Quadruple combination therapy. Okay, so it consists of four drugs. First of all, we will give a particular patient to bismuth salicylate. So bismuth salicylate is actually producing more and more mucus. So this is the first drug. Secondly, we will give PPI, proton pump inhibitor. We will give antimicrobial agents, and there are two type of antimicrobial agent, which is tetracycline. This is antibacterial drug, and another antibacterial drug is also given to them, which is metronidazole. Okay, so this is the quadruple therapy for it, and this is the triple therapy for antimicrobial agents. Okay, now we are going to move toward another type of drug which is used in it. So next we will give that patient the histamine receptor antagonist. So I have drawn here a diagram in order to explain the mechanism of it. So I have clearly explained this mechanism in the previous video. In this lecture we are going to just revise it. So we have remembered that on the parietal cell, this is actually a parietal cell which is secreting HCl into your stomach lining. So on the parietal cell, four kind of receptors are present. So among these four types of receptor, one receptor is your histamine receptor on which the histamine is attacked, and from where the histamine release, I have explained the previous lecture. Yes, your enterochromaffin cells which are present in the stomach, they are releasing serotonin, histamine, 5-H3, and these kind of agents they will release. Among them, the histamine will bind to them, and after binding, this receptor show GS, means this is the G coupled stimulatory response, and after that activate it will show a positive reaction on cyclic AMP. Whenever the cyclic AMP forms, it will activate our protein kinase within the cell, This protein kinase will indirectly activate the proton pumps which are present in it, and proton pumps are responsible for secretion of a proton, for secretion of Cl, and they are also taking KCl and also releasing KCl. So therefore indirectly the H and Cl will combine to make HCl. So this was the whole mechanism of it. Now we are going antagonist, mean we are blocking this receptor. Now we will, what we'll do, antagonist will never allow the histamine to bind with it bind with itself, and doesn't allow histamine to bind, it will throw the histamine out of it. So when it binds, it doesn't allow the activation of cyclic AMP. It gives negative effect on the cyclic AMP. Indirect, the protein kinase will never activated, and there will be the decrease in the secretion of HCl. So this is the whole mechanism of it. Now let's discuss what types of drugs are used in it. So these are the drugs which are used in order to treat with it, which is sim, etine, ran, idine, panotidine, nizatidine. So sim, fan, ren, fan, niza. सो सिम कोई एक बंदा है जो कि भाग रहा है अपनी एक फ़ैन के पीछे, वो फ़ैन का नाम क्या है, नाइज़ा, ठीक है। सो अब यहाँ पर ये जो ड्रग्स हैं, दिस द फर्स्ट ड्रग विच इज़ सिमिटिडीन, this is a pro-type drug. So whenever the word use pro-type, it's mean it has more side effects. So it is pro-type, and why it is pro-type, I will explain this in the adverse effect. Okay, so skip this now. So ranitidine is very important because it has more half-life, and it is used to treat another disease which is called as GRID. So what is a GRID? This is the gastroesophagus reflux disease. So this is actually nothing, it is just a heartburn disease. So heartburn disease doesn't mean that your heart is burning. Actually in this disease, what is happened, the food is entering into your esophagus, and due to the entering of your food which is highly acidic entering into the esophagus, it will makes you a burning sensation in your esophagus, and this disease is treated by ranitidine very effectively. So ranitidine is a drug which also used to treat ulcer, and it also used to treat heart burning or gastroesophageal reflux disease. Phenotidine is very important, and it is used in low dosage, and it is very effective, very safe. It is also available in the form of syrup, so we can give this to the children. And nizatidine is very important, have very safe and very effective. Now discuss their kinetics. So they can be given orally and through the injection, and they are secreted out through your urine. Adverse effects, they are well tolerated but has very small kind of side effects. They have central nervous system effect like confusion, and very rarely and very less tolerated or less severe kind of CNS effect. Now let's discuss the adverse effect of cimetidine. The most important adverse effect of cimetidine is that it causes direct drug interaction. So it can interact with the different drugs. So therefore we say that this is a pro-type drug. This can cause some severe adverse effects. So therefore we doesn't use it clinically. So how it is causing the adverse effect? So actually it is decreasing the absorption of other drugs. So if you give a patient drugs other than cimetidine or other drugs, because a patient has two or more disease, so you give other drugs to that patient, so it will decrease the absorption of other drugs. And by what ways? So actually it is inhibiting the enzyme of a cyclic 2D9. So it is inhibiting this enzyme, and this enzyme is responsible for the metabolism of various kind of drugs like diazepam drug. Diazepam is a analgesic drug which is a benzodiazepine drug. Classifying it, other drugs are warfarin. So it is also interfering with the warfarin. Warfarin is very important. It is collating drug, so it will inhibit this enzyme, and this enzyme is responsible for the metabolism of them. So in short, it will increase the level of diazepam and warfarin in our body. So due to more effects of diazepam and warfarin will observe, like diazepam increase, it means you have more and more sedative actions, and warfarin increase, it means you have more and more clotting activity. So therefore it has quite adverse effect of it. And lastly, it has some other side effects like anti and androgenic effects. So it has anti androgenic effect. So what is the androgenic effects? So androgen is the hormone which is secreted in the males. So actually it is disturbing this endocrine system in the males, causing various kind of diseases. They will cause heavy breast of them, and they cause milk secretion from them, and causing decrease in the production of sperm here. So therefore it has severely effect in the males particularly. Now let's discuss the other type of drug which is used to treat ulcer. So the nextly we will use inhibitor of hydrogen and potassium ATPase proton pumps. So in short these are called as PPI, proton pump inhibitors. So actually what are their actions? So actually these inhibitors are the protype. Protype mean they are in the inactivated form and they convert into the activated form. So why when they are in the inactivated form in the stomach? So in the stomach where the pH is very acidic, 2 pHs. So therefore in this strongly acidic pH they will remain inactive. So when they enter into your duodenum where the alkaline is very heavy, alkaline nature is present, so after that it will absorb into your parietal cell, and after going to parietal cell it will convert into their activated form, and after its activation it will bind to the residue cysteine CH of the proton pump. So proton pump का कोई ना कोई एक रेजिड्यू होगा. रेजिड्यू का मतलब क्या है? रिमेनिंग्स. तो कोई भी जो प्रोटॉन पंप होता है ना, लेट्स सपोज कि यहाँ पर ये एक प्रोटॉन पंप है. सो इस प्रोटॉन पंप के यहाँ पर कोई रेजिड्यू में CH ग्रुप अटैच होगा. सो ये जो एक्टिवेटेड इनहिबिटर आएगा ये इसी ग्रुप के साथ रिएक्ट करेगा और इसको इनहिबिट कर देगा. ये एक नॉन कम्पिटिटिव इनहिबिटर है. नॉन कम्पिटिटिव का मतलब ये है कि ये इरिवर्सिबल होगा. अगर लाइफ में एक दफ़ा आपने ये गोली खाई है तो आपका ये वाला जो पार्टिकुलर पेरिटल सेल है ये हमेशा हमेशा के लिए ब्लॉक रहेगा. टिल आपकी डेथ तक ये वाला पेरिटल सेल के साथ अटैच रहेगा ये वाला इनहिबिटर. सो इसका ड्यूरेशन क्या है? 18 आवर्स तक इसका ड्यूरेशन है और डोजेज 20 mg. अगर आपने 20 mg की कोई गोली दी है तो वो 18 घंटे तक काम करेगा, और अगर एक दफ़ा उसने इसको बाइंड कर दिया तो वो आपकी टिल डेथ तक नहीं हटेगा और आपको डिफरेंट और न्यू पेरिटल सेल की सिंथेसिस करनी पड़ेगी. ठीक है. सो अब हम इसके कुछ ड्रग्स की बात कर लेते हैं. सो इसकी ड्रग्स में ओमेगा पैराजोल, इसोमोपैराजोल, पेंटोपैराजोल और रबी पैराजोल, ये कुछ ड्रग्स हैं. इनको याद करना भी बहुत आसान है क्योंकि इनके एंड में पैराजोल 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 ये तो एंड रिपीट हो रहा है. इसमें आपने OMG याद रखना है. OMG. एसो में आपने सो याद करना, सो. ठीक है. पेंटो में पेंट आप याद रखेंगे और रबिया में, ये रबिया एक लड़की का नाम. ठीक है. सो OMG, सो ब्यूटीफुल पेंट ऑफ रबिया. तो हम रबिया को कह रहे हैं कि तुम्हारी पेंट बहुत ही ज़्यादा ब्यूटीफुल है. सो OMG, सो ब्यूटीफुल पेंट ऑफ रबिया. ठीक है. नाउ अब हम लोग देखते हैं कि इसके ट्रीटमेंट कैसे करना है. सो ट्रीट किन किन डिजीज़ को कर रही है? सो गैस्ट्रो एसोफेगल रिफ्लक्स डिजीज़ को भी ट्रीट कर रही है, अल्सर को भी ट्रीट कर रही है. और एक और ड्रग है ज़ोलिंगर एलिसन सिंड्रोम. सो ज़ोलिंगर एलिसन सिंड्रोम क्या है? ये एक हाइपर सिक्योरिटी डिजीज़ है. हाइपर सिक्योरिटी का मतलब क्या है कि ये इस डिज़ीज़ के अंदर हमारे HCl की प्रोडक्शन बढ़ी हुई होती है, हमारे गैस्ट्रिन की प्रोडक्शन बढ़ी हुई होती है. सो ये एक सिंड्रोम है. सो इस सिंड्रोम के अंदर हम यही ओमेगा पैराजोल या इसोमो पैराजोल पेशेंट को देंगे और वो ट्रीट हो जाएगा. और ये भी कॉम्बिनेशंस में दी जाती हैं. काइनेटिक्स आप इसकी दे सकते हैं कि ओरली भी दे सकते हैं, IV इंजेक्शन के ज़रिए से भी. रिलीज़ कहाँ से होगा? यूरिन से या आपके फेसेस के ज़रिए से. एडवर्स इफेक्ट भी इसके कुछ हैं, जैसे ये वेल टॉलरेटेड, मतलब इसमें ज़्यादा कोई सीवियर एडवर्स इफेक्ट नहीं, लाइक डायरिया है, बोन फ्रैक्चर्स देखे जाते हैं। अगर आप 1 साल तक ओमेगापैराजोल या इसोमोपैराजोल ये ड्रग कंटिन्यूसली ले रहे हैं, सो 1 साल के बाद आपके बोन फ्रैक्चर्स डिटेक्ट होना शुरू हो जाते हैं। सो ये इसका एडवर्स इफेक्ट है। दूसरा एडवर्स इफेक्ट ये है कि डिक्रीज़ कर देता है विटामिन B12 की अब्जॉर्प्शन को। तो एक्चुअली विटामिन B12 की अब्जॉर्प्शन के लिए हमें एक इंट्रिंसिक फैक्टर चाहिए होता है। तो ये एक्चुअली उसी इंट्रिंसिक फैक्टर के साथ जाके बाइंड कर जाते हैं। तो जब उनके साथ जाके बाइंड करते हैं तो ये विटामिन B12 को अब्जॉर्प्शन को कम कर देते हैं, जिसकी वजह से उन पेशेंट के अंदर जो ये ड्रग ले रहे हैं उनके अंदर विटामिन B12 की डेफिशिएंसी हो जाती है। साथ ही साथ ये कैल्शियम को भी अब्जॉर्ब नहीं करने देते हैं। आप कैल्शियम की जितनी मर्जी ड्रग ले लें, कैल्शियम कार्बोनेट, कैल्शियम जिस मर्जी फॉर्म में कैल्शियम ले लें, ये कैल्शियम को अब्जॉर्ब नहीं होने देता। कैल्शियम अब्जॉर्ब नहीं होता, इस वजह से ही बोन्स के फ्रैक्चर्स जो हैं वो होना स्टार्ट हो जाते हैं। लास्ट इसका एडवर्स इफेक्ट ये है कि ये ड्रग इंट्रैक्शन कॉज कर सकता है, डिफरेंट ड्रग्स के साथ इंटरेक्ट कर सकता है। अब कैसे इंटरेक्ट कर सकता है, जैसे एक ड्रग है जिसका मैं नाम लिखने जा रही हूँ, ये इस ड्रग के साथ इफेक्ट करता है क्लोपिड्रोजेल। तो ये एक ड्रग है जो कि इनएक्टिवेटेड फॉर्म में होती है, ठीक है। सो IA से क्या मुराद है, इनएक्टिवेटेड फॉर्म में होती है और इसको हमने एक्टिवेट करना होता है, और इसको एक्टिवेट करा होता है साइटोक्रोम P2C19। ये एक एंजाइम है जो इसको एक्टिवेट कर रहा होता है। अब अगर हम साइक्लोप्रिडोजोल के साथ साथ हम इसी पेशेंट को ओमेगा पैराजोल भी दे रहे हैं, ठीक है, ये दोनों ड्रग्स दे रहे हैं। अब ओमेगा पैराजोल क्या करेगा, उसने जाके इसी एंजाइम को ही इनहिबिट कर देना है। अब जब यही एंजाइम ही नहीं रहेगा तो क्लोपिड्रोल जो है वो इनएक्टिवेटेड फॉर्म में ही रहेगा, यानी वो एक्टिवेट नहीं होगा, और अगर वो एक्टिवेट नहीं होगा तो वो अपना काम नहीं कर सकेगा। और इस ड्रग का काम क्या है, इस ड्रग ने फ्लोटिंग को रोकना होता है, ठीक है, यानी ये एक एंटी थ्रोम्बोजेनिक ड्रग है, यानी इसने थ्रोम्बस की फॉर्मेशन को रोकना है और ब्लड क्लॉटिंग को रोकना होता है। सो अब अगर आपने साथ ओमेगापैराजोल दे दिया, वो इस एंजाइम को इनहिबिट करेगा इनडायरेक्टली। क्लोपिड्रोजेल अपना जो एक्शन है वो नहीं कर सका, ब्लड क्लॉटिंग नहीं रुकेगी। सो ये इसके ड्रग इंट्रैक्शंस आ जाते हैं कि अगर आपने ये दोनों ड्रग्स पेशेंट को दे दिए हैं तो पेशेंट को कोई फ़ायदा नहीं होगा। सो इसलिए हर ड्रग को देने से पहले ड्रग के इंट्रैक्शंस को देखा जाता है कि अगर ड्रग इंट्रैक्शन हो सकता है तो हम वो पेशेंट को नहीं देते हैं, या उसका कोई ना कोई सब्स्टिट्यूट देते हैं ताकि ये ड्रग इंट्रैक्शन ना हो। अब हम चलते हैं नेक्स्ट ड्रग के ऊपर जो कि अल्सर को ट्रीट करती है।